Hi, everybody. Joe Alaria, partner and wealth advisor with Carson Alaria Wealth Management. And today I'm coming to you to answer some questions from our last month's retirement power hour, which was on Medicare. We actually did 2 webcasts last month. One of them was on Medicare. So let's jump right in and answer some of those questions. The first question is, what is the difference between original Medicare and Medicare Advantage? So primarily, structurally, original Medicare is made up of Part A, which is your hospital coverage, and Part B, your medical coverage. You could add Part D, which is prescription drug coverage, if you wanted to. So that makes up original Medicare. Medicare Advantage is Part C, which is something that tries to encompass all of those other parts into one. Another thing to note is that original Medicare is really designed more like an 80-20 plan. So usually you have Part A, Part B, maybe Part D, and a supplement if you go with original Medicare. Those are some main differences. Next question, what is the cost for Medicare? Well, again, it depends if you go original or Medicare Advantage, but for Part A, the premium is typically free if you've worked at least 10 years. There is a deductible per occurrence of $1,484 in 2021 for any hospital expenses. And then for Part B, you have a premium of $148.50 per month and a deductible of $203 per year. After that, Part B is only going to cover 80% of your medical expenses. So again, it's important to get that supplement to cover the other 20. We're going to talk about supplements next week, so I don't want to steal the thunder from next week, but tune in to learn more about supplements next week. The cost for Part D varies depending on the amount of drugs you take and what tier they are. And the same goes for Medicare Advantage. The cost could vary. However, you do have a lot of plans out there that are zero premium Medicare Advantage plans. And so there are going to be some costs associated if you have medical expenses, etc. But the premium month to month could be zero for some Advantage plans. Next question, when do I need to enroll in Medicare? Well, 65 is kind of the magic number. And you have 3 months before the month you turn 65, the month you turn 65, and 3 months after the month you turn 65 to enroll. And you need to enroll on time or else you could pay penalties. And the late enrollment penalty for Part B coverage is a lifetime penalty. It never goes away. So you really want to make sure that you talk with a Medicare specialist to help you determine if you should go on original Medicare or Medicare Advantage and to help you enroll at the right time. Common things that cause this. Number one, people say, well, I have a friend or a neighbor and they didn't have to sign up. They just got Medicare automatically. So I didn't think I needed to sign up. Well, that could be the case if you're receiving Social Security or railroad retirement benefits. You might not need to sign up. If not, you need to sign up. And then some people say, well, I'm working or I have spousal coverage through my spouse's employer, so I don't need to get Part A and Part B. And that could be the case, but according to Medicare.gov, it depends on the size of your company or your spouse's company. If there's less than 20 employees, Medicare.gov says you probably need to sign up when you're first eligible, or else you could have late penalties. If there's more than 20 employees, you might be able to delay it and avoid those penalties. But again, talk to a Medicare specialist, give us a call, and we'll help coordinate it for you and get you connected with somebody to make sure you're enrolling at the right time. So those are some common questions about original Medicare versus Medicare Advantage. Next week, we're going to answer questions about supplements. And the following week, we're going to answer some questions about Medicare Advantage. So stay tuned. And until then, I'm Joe Alaria, partner and wealth advisor with Carson Alaria Wealth Management. Have a great rest of the week. Bye-bye.